guys, it's Zara and welcome back to my YouTube channel. Yeah, it's been a minute. And I feel bad because I planned a video for you guys last week. It was supposed to be up, nice update, you guys see what's going on in my life, and boom, I lost the footage. Don't know how, but I did. So here we are. In today's video, I'm going to show you guys how I mentally, physically, emotionally, spiritually prepare for my final exams. I have Adult Health 1 final exam tomorrow morning. I'm nervous, but I studied and I worked hard studying. Tons and tons of flashcards on Gizmo AI. Over 900 I have looked over and practiced and learned, and if I don't know it, then I don't know it. I have test anxiety like many of you guys. We are the same. Like, we're literally the same. But what I do is I always take like these stress gummies and I stand by it because it really helps me. I usually take it 20 minutes before taking my exam, and then as soon as I'm getting to like my 5th or 6th question, I start feeling like my body's relaxing. I'm like, okay, good. I'm fine. I know what I'm doing. I studied. I prepared for this. But hey, we're gonna do it together. We're gonna do some final studying and I'm gonna just wrap up what I've learned, go over something that I may not feel as sure or confident about, and that's how we're gonna do it and hope for the best. If you guys are seeing this video, most likely I have passed my final, but I will let you know in the ending. Before I get started, we're gonna go get some Chinese food and I need my coffee for the day because I will not function without it. So let's do my skincare real quick, some quick makeup, and be about it. Sure. I don't know how that transition looked. I hope it looked okay. It's only 12:49, so let's get ready to leave. I'm gonna use my Mr. My hair looks crazy. Guys, it's like a blow up gone wrong. Let's roll. We just got back and I'm gonna get changed, but my knee hurts so bad. This was an old injury and it's reoccurring. It is raining. Maybe it's like early arthritis because I'm old. You guys, I absolutely adore my pajamas. These are from Five Below. Let me show you. You know, my Christmas tree is still up. I'm going to take it down this weekend. Let's not talk about it. So I'm gonna go over my flashcards on my broken tablet for about 45 minutes. And I'm also gonna revisit some medications that I'm not very sure of, just because I know there's a lot of CNS meds that I'm still a little bit iffy about. These are my holy grail. If you don't have them, if you're a pre-nursing student or you are taking pharm, I recommend getting these. Metric chest expansion is effective. Oxygen saturation is greater than 94% is effective. PaCO2 that's 55 mmHg is ineffective. I have studied so many flashcards that I feel like I'm gonna be okay in adult health too, because I've learned a crap ton already. If I pass my final tomorrow, that means I have no more schoolwork to do, and the only thing I have left is clinical next month. I do my shifts, I do my concept map, and I am done with the semester. Mind blowing. I'm so excited. I'm a visual learner. I'm also a hands-on learner. I do prefer hands-on. That's why I'm looking forward to clinical, because I would love to get the hands-on experience operating as a nurse, obviously under the supervision of a nurse. That is how I'm going to remember my skills easier. That is how I'm gonna be able to put 2 and 2 together. That helps me evolve my critical thinking skills. So I want to be up in that hospital as much as I can. Now let's go over my flashcards. Any medications that I've learned from this deck alone, all of my CNS, my central nervous system medications are usually like SSRIs, anti-epileptic, opioids, pain management, all of these fall in there. And I actually didn't know that. I knew to an extent what acetaminophen is, that's Tylenol, and I know what all of those things are, but I didn't know how much goes into the CNS until I started using these cards. Okay, so I've seen a lot of phenytoin, I've seen a lot of valproic acid for my study guides. Also, if you are attending WGU and you don't know how to access your focus study guide, you just go into, I believe, the specific class. You go to WGU Connect. That's in like the course system thingy. There's a way that you can navigate through there, and it's like a group chat. Imagine like Facebook group, but through the WGU website itself. That's where you can find the focus groups that instructors have put together. They give us the rundown of what we should be expecting on the final exam, and I just took that file, put it in Gizmo, and just made flashcards out of that, and I've learned so much, so utilize it. Side effects we can expect is nausea, vomiting, heartburn. Maybe give them an antiemetic if it doesn't interact. And one thing I've learned with all of these medications that are usually prescribed and things that cannot be over the counter, always consult with your doctor before you discontinue, because just stopping cold turkey is the worst thing to do. Especially if you are on an antihypertensive, you will have rebound hypertension, and it's kind of like you were never on the medication to begin with. So you always want to taper down, but it's always safer to speak to your doctor first. When I'm doing active recall, I don't always feel like going to my whiteboard, so I do pull up like a blank screen and write down everything that I know about it. That's how I remember these things. I made a promise to myself that once a week I will go over my skills for the rest and the duration of nursing school, so I never lose my skills. I have said this before in my TikTok videos that once you are checked off on a skill in nursing school, you're not going to revisit it. Most likely you will not. That's just the reality. We don't have time. It was your responsibility to go over it on your own time, and that's just what I do for myself. Since I'm already studying, I might as well just get it done. And it's also content for you guys. I'll try to explain it as I go. That way everybody's happy. So let's go. It's time to revisit my bag. While I was in lab, I learned that when I'm inserting a catheter, I have to be on the patient's left side because I'm left-handed. So first I'm gonna clean my hands, and then I'm gonna don my gloves. I have used this catheter kit like 12 times already from lab up until this point, so I had to use my medical tape to get everything back together. Everything is used and damaged essentially. So you want to turn it, peel it away from you first, and then to the sides. And we're just gonna say that at least an inch of each corner is contaminated and it's no longer sterile. I don't want to touch that. Now I have my sterile gloves. I'm gonna put that on the bedside table. Quite frankly, I wouldn't even be wearing gloves right now because I'd have to put on my sterile gloves. So we're gonna take this off. Okay. So you cup your hands and you want to not really touch anything. That's what's scary about donning sterile gloves as a new nursing student, new nurse, because you don't want to contaminate anything. Pinch. I have used these sterile gloves many times already, so it's incredibly easy to get on, but skills check off, oh, that was a nightmare. You kind of scoop under. This is already broken. This entire kit is between the patient's legs so you can work. Here is the side to extend your sterile field, and the shiny side goes down. And then you get like your, this looks like just paper. You place it carefully on the patient's private area. Boom, you just drop it there. You have all this space to work. I like to set up my field a certain way. I put the catheter in the front. What I will say, what they taught us in class is that for this part, as soon as you open your catheter kit, it's good to just put this at the side of the patient. That way it's a garbage bin. So let's pretend I did this in the beginning. Open it. 3. This goes in the garbage. I would pull off the plastic wrap around the catheter and I would dip it inside of the lubricant. And what I personally do for the last step is I connect my sterile water. Once you touch the patient, your hand has to stay there. And once you break sterility, you kind of have to start over. I'm just gonna place my hand here. It depends on what you want to do. And so I have 3 of these to clean. So you clean the one away from you, drop that in the bag, the one closest to you, and then you go down the middle. You always want to instruct your patient to relax, and you don't want them to bear down because then it's going to be harder to insert or advance the catheter. And then you just advance. Right. I would inflate the balloon by slowly injecting the 10 cc's of water. I'm not going to do this right now because it's going to spill all over my table. You slightly pull until you feel some resistance. Now that all of that is done, you can move your hands. Hand hygiene, and then you don on some new gloves. Grab your catheter, tape it to the patient's leg, make sure they have some wiggle room. You don't want it to be too tight to where it tugs and pulls on the catheter. And then you hook this on the bottom of the bed. There's like a rail sides of the bed, and you keep it below the patient's bladder. Always let them know it has to stay below because if it goes back, they can get a UTI. And then you clean them up and you discard all of this. All right, we're back. So the next thing that I'm going to do is an IM injection. I don't have my fake medication. I only have insulin. My fake medication ended up spilling out, I think sometime after lab. I can't remember. So we're going to pretend. Here's my skin pad. And I would make sure that I would draw up the right dose. And also make sure that it is the 7 rights. That is how you prevent medication errors. Here we go. I'm not even going to pull the cap off because I want to prepare the patient's skin. The skin just going in a circular motion. And now I'm just going to wait for the skin to dry. You never want to blow on it. That, like, I don't know who does that, but you don't blow on the skin and you don't fan the skin. You just wait for it to dry. This is an IM injection, so it's just going to go in 90 degrees, and we just want to get them ready because it will hurt. So just go in there. You see this safety? You pull that up. I'm not going to do it now because I need to reuse this. Don't ever reuse a needle, but this is for practice purposes. So I would pull on that, and then I will discard it in the sharp spin, and that's it. It's pretty easy. And my last skill, very easy. It's not my favorite skill, but it's not my least favorite either. We're going to be doing NG tube. So we have the nose and the mouth. My NG tube kit has also been used and abused. Let's pretend this is a fresh new kit. We have never used it before. It is clean. It's ready to go. I don't have my medical tape with me, but it's not like I need it because this patient does not have a cheek. They don't have ears, so why does it matter? You want to measure from the tip of the NG tube with the tip of the patient's nose, pull back to the ear, clamp where that ear is. I were doing it on a human being. It would be from here, hold that piece to here. So I believe, I don't have to recheck. Is it the xiphoid process or is it the sternum? That really depends. I would say the xiphoid process. Don't quote me on that. Do your research, please. And I also have to do my research again because it's been a minute since I've done this. But let's just say for practice purposes, we are at 50. You just get your medical tape and you wrap around 50. It's harder in lab because the mannequins, it's just hard to get down there. You know, it's not real flesh. We don't actually get to use the lubricant on the mannequins because we don't want to get them dirty. So it is harder and it's much easier to do it on a person. But for here, you just encourage them to just drink that water. You're okay. Once that's in there, there's 2 ways that you can secure it to the patient. It really depends on the nurse. I don't want my patient to be uncomfortable. So the way that they taught us in school is you either can get a piece of medical tape and you tear it in half, not all the way, do it right here. I personally don't think that's comfortable and I wouldn't want to have this just in my face all day. So what I would do for my patient, pull it at the side and I will tape it to the side of their cheek. That way it's out of their way, out of their face. And yeah, it's quick and easy. This was like one of the easiest skills that we have done. Yeah, that was really fun to do. I love showing you guys my skills and I'm so excited for lab in June. I will show you guys my new skills. It's gonna be really fun and I'm looking forward to it. I'm gonna try to get a more in-depth version of lab now that I know what to expect going in as far as my teachers go and the lab setup and everything. So yeah, that wraps it up for today's video. Thank you guys so much for watching. Don't forget to like, comment, and subscribe, and click that bell down below so you get notified every single time I upload. I love you guys so much, and I will see you in another video. Good night.